Aloha. Thank, thank you for inviting me for this very interesting gathering. I'm really surprised that we had such a big attendance. And I was told by Attorney Egan that this group is very attentive and they ask very tough questions. So I'm kind of expecting it. And if you look at the joke on the liver, wait until you see the joke on the gastroenterology. I have so many really nice joke about GI, but I'm not going to talk about it today. First, about myself, I was born and raised in Taiwan, and my mother is Japanese, my father is Taiwanese, and I was educated there through medical school, had a couple of years training there, and then come to United States. I spent about 3 years at Yale University. That's when I really get into the interest of the liver disease. And then from there, I went on to Buffalo General Hospital, the State University of New York in Buffalo for my gastroenterology training. And then I decided to move here because my parents at that time still in Taiwan. It would take me 24 hours to fly from Buffalo to back to Taiwan to see my parents. So Hawaii is a perfect middle station. And it's very similar to the weather and the people's aloha in Taiwan. So I'm really very lucky, and I stuck in here since 1981 very happily. All right, well, my job today is to talk about liver disease. And actually, before I start, I'd like to know if anyone here is or was, their profession is the medical field on biology, biologists. You are, can you raise your hands? Okay, so very good. So I don't have to worry about tough questions. All right, so the topic is about common liver disease. And then in your handout, I have a small little draft or a paper about liver. And I hope you go through it very easily. And then I have a confession to make. It's held by ChatGPT. I give an idea and they come out with this very wonderful paper. But I think it's a very to the point. And it is important knowledge. So many of you probably know where the liver is, right? Okay. So my objective here is about health, because that's the most important part, and then the liver disease. You really want to emphasize a lot on the health, which means prevention. And we have many things in the fields of a liver can be done preventatively. Vaccines is one of them, lifestyle changes. And I think it's an ounce of prevention is worse than a pound of prevention. I think that's a very key concept I want to get across. So the location of liver, for those who didn't know where it is, after so many years with them, is on the right upper quadrant, and is the height of the top of the liver dome that look like a Napoleon head. Is right at the level of your right nipple line. And it expanded down to around the rib cage, the line of the rib cage. The size of it is roughly about an American football. Okay, so it's pretty good size. Of course, some big guys, like Akimono, the wrestler will be huge, and a little Japanese lady will be kind of tiny. But anyway, that's kind of the general idea. And the locations is right on the top of all the GI tracts and the GI compartments. As you can see here, the gallbladder is right below it, the pancreas, the stomach, and the small bowel and the large intestine, and so around below them. So you almost serve like a guardian, because our GI tract accepts everything we put in there. So anything we eat go to the GI tract, and then go to the liver. So liver has to really guard. It's just like a border, a border patrol or the border, a protection agent. And the weight is about 3.3 pounds. For my fields, when I was involved in the liver transplant, the size is important because you cannot fit a big liver where people donate it into a small person's, or a small liver in a big person because it doesn't really hold in the place. So that in our fields, the size of the organ is very important. And it contains two major lobes, right lobes and the left lobe, as you see that. Right lobe is on the right-hand side, the big one. The small one is on the left. And they are very small little lobules inside microscopically. And the right lobe is a large one. There's a caudate lobe between the large lobe at the left and the right, in the middle of it. It's an inferior section of the liver and the left lobe of the liver. I hope this doesn't get too much detail, but I think that's an idea to start. And here we go. Now the liver is very unique, where they actually receive blood from two supplies. Receive, not going out, just receive. Because normally if you heard anything on the cardiology or vascular side of the story, any blood that comes into the organ is called artery. And any blood that after they enter the organ going out is called vein. But in the liver, you receive both the artery blood and the venous blood into it. And that is very interesting design. I don't know who designed that, but it's a wonderful design because the artery provide oxygen. They only provide about 25% of blood supply to the liver. And the other 75% of blood coming from this blue color vein is called portal vein. And the portal vein is where all the nutrient that our GI tract absorbed goes through this conduit, a big highway. It transported all the things that get absorbed, that get across the tissue barrier into the blood, and they have to go through the liver. So it can imagine everything that you eat that passes through the GI tract would have to go through the liver first. And that's why it is so important, very central, I think. And in my experience as a transplant hepatologist, it's also interesting to know of the organ that need to be transplanted, the liver is most tolerant. They accept foreign things very easily. So when we are treating them, we don't need really strong, important tissue matching. You heard about matching because person who donated organ and the person who received the organ, they have to have very similar tissue type so that they don't reject each other, because our body is born to reject things that doesn't belong to them. But the liver are more tolerant. And the theory, what I think about is because the liver is just like a port, seaport or airport, and there's all the foreigner coming through. So they know them how to deal with it. So they are more tolerant. They will not see them and they're trying to kick them out. They will just see who this person is and then accept it. It's a very interesting observation that I made over the year that was surprised, because if you have a kidney transplant, they are very stringent. You have to do tissue typing, you do bone marrow, tissue typing, heart and lung transplant, tissue typing, because if you don't, the tissue will not survive. Okay, but liver is very tolerant. All we need is a match of blood type. Okay, so that's interesting. And from the below, because I want to show you the position of the gallbladder, because gallbladder is also important organ, but also not that important because you can remove it and still live. Okay, you'll be surprised to know that almost 500,000 gallbladder was removed each year in the United States. because of cholecystitis. It's overtake appendicitis. Okay, I'm sure your friends or relatives, if you ask around, someone probably don't have the gallbladder in there. Okay, so it's a very interesting organ. It is important, but it's not vital. And that's why we can remove it. But you will be very happy that they're there because you don't get other gastrointestinal problems because they are storage of the bile that made by the liver. And this bile is a very important component to help our body to digest anything that is fatty. Okay. The bile is, if you take it out, you put into the fat, it would dissolve into like water. It's hydrolyzed the fat. And our GI tract can only absorb things that are hydrolyzed, dissolve in the water. And you know, if you try to dissolve fat in the water, they don't really mix. But you put soap in there, it will then dissolve. So bile is just like a soap to help the fat that we eat become water soluble, and that's when they get absorbed. So imagine you don't have gallbladder. For the beginning, you would have problem with French fries, fried chicken. Okay, so anticipate that if somebody going to have a gallbladder surgery. So what's the functions? Like I say, is a very central part of the digestive system because they receive those blood from the GI tract. They metabolize the sugar. Carbohydrate is a sugar, starch. And when the carbohydrate coming through the GI tract, they have to be break down into single units, just single sugars. For instance, glucose, the white sugar. They have to be break down to that before they'll be absorbed. So if you had a bowl of rice, not all of them get into your system because they have to go to the GI tract. The enzyme would digest them into a simple sugar before they get absorbed. All right. So there are certain food that we eat as starch, but they had a very high fiber in there, very difficult for our GI tract to digest. What happened is they don't get absorbed. And when they don't get absorbed, they go down the pipe and people get gassy and get diarrhea. So that's when the digestive system cannot digest. So if you eat a lot of fiber, for instance, the sweet potato, you notice if you have sweet potato, they have a lot of fiber. At the end of the day, you feel you have bloated and you're producing quite a bit of gas. Those gas was produced by the bacteria or we gut microbiome in the GI tract that digests those fiber into water and the air. Air is CO2, and that's what we have. This gas coming out from the other end. If you had a high fiber diet, but which is good because we don't have. When you eat something, you don't want to absorb every sugar of that into your system. They also metabolize fats and the protein. This is the three major nutrients that our body need. And they have to be processed first inside the liver by metabolizing in. And these are the food that we consume. It removes medications, alcohol, hormones, or other substance that we put into our mouth. They have to really detoxify them so that they don't get into the bloodstream and cause trouble after the liver. And you can imagine some of them are very toxic to the liver. So we start to see a condition we call drug-induced liver injury because the medication caused damage to the liver. And that could be from prescription medication, but could also be from supplement. There are ingredients that they cause trouble in the liver that we don't even know they exist are inside there because when they are making those supplements that could be contaminated or sometimes don't even know that they are there. I have a story to talk about this. You remember kava juice? The local people love kava. Many years ago, I first noticed the report from Germany that there is about 29 people getting into a severe problem with acute hepatitis. Some of them had to be transplanted, and some of them died. And they all traced to that they are having this kava capsules that was made by a German company. And so that really caused a big problem for Hawaii. I didn't know that at that time, that Hawaii export kava in an amount of millions of dollars. And then suddenly the whole industry went down the drain. The state department asked agriculture departments and the phytochemistry department to find out what's going on. Why we Hawaiian drink that for thousands a year, nothing happened. Why the German eat it and they get into trouble? We have to find out what's the difference. It turns out that local people, when they have kava juice, they use the kava root. They don't use the stem. They cut the stem away. For reason they probably have the wisdom for so many years of having kava, knowing that the stem is really bad, but they don't know why. They just cut it off. And these businessmen from Germany come to Hawaii, come to the South Pacific, and want to buy the roots because they think this is a calming juice, calming effect. They're going to make it a capsule and commercialize it. And it was very expensive because production is not huge. And then they see those workers cutting off the stem and throw them away. They said, "Oh, how much do I have to pay for this?" They said, "No, you can take it home." And they just don't know why these people want those stem. Turns out, and this is a work from phytochemistry department, that there is, not only they have kava ingredients for the real kava juice, they have several other proteins inside that stem that is not in the roots that cause liver problem. And so the problem resolved. So kava industry come back to a normal size. And I'm sure it's much more now. If you go down to Kahuku, you can have kava juice. It is a kava juice. I think Waikiki probably still have it. Very interesting story that I encountered. But that's how things could happen, that if you have to be very careful in terms of the supplement, particularly in minefields. The liver also stores vitamins, minerals, the food molecule that comes through the GI tract, such as shown here, and they excrete biles. The liver make bile, and then they get into the GI system. First, they were stored in the gallbladder, and when we have food, there was a signal goes to the gallbladder, asks them to squeeze. Then the bile will come down the pipe to the digestive tract to mix with the food that we ate and digest the fat part of the food that they can be absorbed. That's kind of the digestive system work. And they also convert sugar that we absorb into glycogen, which is a storage form of the sugar. It can be, you can find it in the liver, but also you can find it in the muscle. And those are kind of petroleum reserve, so to speak, that if you suddenly have no food to eat and your sugar go down because you don't eat, you're fasting, this sugar storage will then turn into the sugar to be used. And so it's like a reserve energy source. So it's a very important part of the liver function. And it also regulates coagulation. They produce certain proteins and factors that help us to make the blood coagulate when there is a cut of the vessel. So it's very important that one of the tests we use to determine how good or how bad the liver is working is called prothrombin, which is a factor help the blood to clot. And we measure the time this person's blood to clot. And that time is very important, kind of indirect way telling us how bad the liver is. And we use that very frequently in our work. And they filter blood. And the liver cell is the main cells inside the liver that about 80 to 85% of liver contains the cells. There's another cells in there, which is about secondary important, called cholangiocyte or bile duct cells, so to speak. They're the one lines up the conduit or the tuber system that transport the bile that's produced by the liver down to the bile ducts, gallbladder, and down to the digestive tracts. So that's kind of what the hepatocyte work in the center. They produce bile, they process all the things that I mentioned earlier so that our body can be protected or can be benefited from the nutrient that derive from that processing inside the liver. So this is very quick. It's kind of complicated, but the reason I bring this up because bilirubin is a pigment. And in a very general public feeling, if somebody get yellow jaundice, they must have liver disease, okay? So I just want to put a few minutes on this because this bilirubin is a pigment inside the red blood cells. And that's what makes the red blood cell red. But our blood cell, the red blood cell only have about 120 days lifespans. So they were made, 3 months later, they just get destroyed because they become too old to function. They are carrying the oxygen, they are not as good. So when they got destroyed, our body have a recycling system. Many things that in the red blood cell got recycled, including the pigment. And that's what the bilirubin comes from. And where do they do recycling? Inside the liver. So liver process them and then making into bile. And the bile is a byproduct of this process. And the pigment will be then turned back to the bloodstream and go to the bone marrow and to be used again. So this is kind of the circulation. So you don't have to, it's a recycle business basically the liver is doing. So that's kind of in a nutshell about this bilirubin metabolism. And this is the anatomy of the bile ducts. I've you showed the green part of it. And this is the gallbladder. And this is the bile duct. And they go all the way down to this part of the GI tract called duodenum. That's where the bile come out. And this is important because many people who got gallstones, they go down the pipe and the opening of the bile duct into the duodenum or the digestive system is tiny. And if the stone gets stuck in there, you got very severe pain and inflammation. And sometimes they also cause the pancreas. The pancreas shares the same ductal system on the other end before they empty into the digestive system, the duodenum. So if you're stuck there, they can cause acute pancreatitis. So that's kind of a very important concept in our field. Somebody coming with abdominal pain, there could be a gallbladder there, there could be stone in there, and the stone can move to cause problem in the bile ducts and the problem in the pancreas. So you go to your office, and that's the first part of the health. Now is disease part. So conditions that can make the liver sick. First of all, genetics. They're such as what we call biliary atresia. Some reason when kids were born, they don't have really good bile duct system. So they become jaundice. They usually die if you don't do something about it. It could be infections. Infection could be virus. For instance, hepatitis B, hepatitis C, and hepatitis A. Bacteria. People got sepsis. They can get into trouble with liver, fungal infections, and parasitic infection. We don't see that too many nowadays. In fact, in my career, the only time I see the pancreas when I was visiting Vietnam. I was giving talk there, and they started to come to me and ask me a lot of questions and ask me what's going on. And I said, could be one of those lookworms that when you have this snare, they eat raw snails and then suck it in. I don't know if you go to Vietnam or China, that's one of their delicacy, and there are just parasites in there, and they will go to the liver, cause trouble, and they will lead cancers. Autoimmune liver disease, which could be autoimmune hepatitis, bile duct hepatitis, and those are conditions that can cause problems in the liver. Medications, I just mentioned about it, and toxins, including the supplement toxins and alcohol. Now, when I give talk in my profession, many doctors will come to me, what do you mean significant drinking? And we don't really know. And in fact, if you ask my patients, say, how much do you drink? The answer could be any place. They could be drinking up to the day before, but they will tell you, I don't drink. Today, they just don't mention today. But the number here is basically like an average. It's very hard for you to assess how much people to drink. So the easier for us to remember for me is that if a man drink 2 drinks a day, that's a problem. If a woman drink 1.5 drinks a day, that is a problem. And so that's kind of the general rules. You can pretty much tell people who have problem with alcohol use, and those, just have a like a general very moderate drinking. And the drinks, like 1 drink of spirits, 1 glass of wine, and 1 12-ounce of beer is considered 1 drink. And that's brought me to this particular topic, which is I think the big problem in Hawaii now or globally called fatty liver disease. And that's another topic that I can talk about an hour for it. But basically, the fat deposits inside the liver causing liver disease, and they can cause cirrhosis, they can cause liver failure, and they may need transplant. In fact, over the last 10 years before I get out of transplant program, fatty liver disease as a reason for liver transplant listing is number 2 in the general population. And that's true nationally, true locally. But more astonishing to me is that if you just look at the woman, that's number 1, okay? Alcohol mostly male dominant, but non-alcohol related liver disease in the fat, woman number 1. So that's the big problem I think we all have to really take into our thinking. So I listed before, and this is very quickly, I was going to address pretty much this 3 major cause of liver disease: alcohol, hepatitis B and C, because that is very important part of the liver disease in the state of Hawaii, mainly because of hepatitis B and hepatitis C. And very fortunately, now we have very effective management and treatment for these 2 diseases. So that, remember, I say that fatty liver, number 1 and number 2 in the transplant list. 10 years ago, 15 years ago, number 1 is hepatitis C. Number 2 is hepatitis B. Fatty liver is all the way down. But since this wonderful medicine become available, that the need for transplant dropped just like a cliff. It's very amazing. So I think that's as medical progress going on, this disease will be much more easy to manage. The other condition, autoimmune hepatitis, drug, and so those combination, people can have alcohol and fatty liver disease, alcohol and hepatitis B or hepatitis C. If they have combination factors causing liver disease, the disease is going to go faster and going to go into trouble faster. These are less common disease that I'm not going to address it. It's very complicated. Now, just one slide about hepatitis B that I mentioned earlier. There are 5 viral hepatitis, a virus that use the liver as their prime targets. It's important because there are many viruses other than these 5 can cause liver disease, but that is not their main target. For instance, Epstein-Barr is a disease that affects the entire body, but they can also cause trouble in the liver. But this 5 virus is pretty much go to the liver, cause trouble in the liver. So they're starting from A, B, C, D, E. And hepatitis A, I want to mention because we as a community still have hepatitis A breakout from time to time. If you remember several years ago, there was a Genki Sushi episode. That is hepatitis A. But almost every year, CDC will come out report of hepatitis A outbreak in those people who have mixed vegetable green salads, strawberry, even scallions that come from other countries can harbor the hepatitis A virus and cause trouble. Now, the important thing for hepatitis A in our community is that there is vaccine available, and they are very effective. And that's the part of the prevention that I was talking about. So I think in the state of Hawaii, or probably nationally, hepatitis A is a vaccine that is provided to keikis. So I think, I don't know, 5 years or 6 years, they were important for the pediatrician to do the hepatitis A vaccine. Hepatitis B vaccines transmits from mother to child. And so we have actually do very good job. Our OB doctors is identify the woman who are pregnant who have hepatitis B. They'll give the vaccine to the baby when they were born. The time when they were born, they give the shots right away. There are 3 shots they give, and they were able to protect the baby from getting hepatitis B infections. That's probably the major public health, success that I know. And hepatitis B is recognized by WHO as the cancer-causing virus, one of them. So it's so important that vaccination should be done and should be provided for the populations. And the other virus, Hep C, that I spent almost 20 years on this virus, and that job is done because there's this effective medicine that pretty much cure 100% of those people who have hepatitis C with a very short and safe therapy. All right, so fatty liver is a major storm that's coming to us. If you see the sandstorm is a huge number of population. About 30% of general population have fat in the liver, but not all of them get into trouble. 5% do. They're going to need transplant. Those are the patients. And this is the typical pictures from steatosis, which is a fat in the liver, to MASH, which is inflammation because of the steatosis, and to liver cancer and the cirrhosis. Okay, and there's a staging of that. And I mentioned earlier, alcohol-related disease is the #1 cause for transplant, and NASH is #2, which is going up. Not saying this is 2022. If you look at 2024 data, it's even higher. And it is a multi-system disease. It's not just affecting the liver. Actually, it turns out that #1 cause of death with this disease is cardiovascular disease, because they cause stroke, they cause heart attack, and people die from that. #2 cause of this disease, this condition, is cancer other than liver. And #3 is liver-related problem. So there are still a very important reasons for us to pay attention to this disease. So, you want healthy liver or you want a cirrhotic liver? This is the cirrhosis on the biopsy. You see those green things? Those are the scar tissue as a result of the continuing inflammation and injury to the liver. And this is the end of the road. If you have cirrhosis, because they can shows fluid. This is a gentleman with fluid in the belly and cirrhosis. And you can see that the muscle in the hands are almost gone, because one of the things that our liver do is produce proteins, which is a major part of our muscle mass. And this person is not able to process that. So losing proteins. And the other one is they can cause varices on the right-hand side. Those are the veins. Okay, this is a normal looking esophagus, and this is the vein. And this can bleed And one of the major reasons people die suddenly is because they start to bleed. So this is a very serious problem. And then cancer. That is the main problem. We don't have too much medicine, although it's work in progress to treat patients with cancer. I just talked to Dr. Bueno. I say, please, you have a lung cancer trial, next liver cancer trial, please, because we need it in this island. So I give you a lot of things about liver. Just get paranoid about it. But if you follow your doctor's advice, you'll be okay. And here I learned something from my wife, because we have problem advising our patient to stay away from alcohol, not to eat too much, lose weight, exercise. You keep talking about that. Then I learned from my wife, because I found out nagging is a very good instrument. So I told my colleagues, because they don't say, I say that before, I don't want to keep saying it. Say, no, if you keep saying it, one day they will follow your advice. And I'm sure here, you must have a lot of wife and mother here. That is a very important instrument. So sometimes I jokingly write a prescription to my male patients, say, wife nagging. That's a prescription. And that really works. And that's how I handle the liver. Thank you. I think that's.
Dr. Tsai, thank you for that wonderful presentation. Thank you for permission for us to nag our husbands, right, lady? Do we have any questions from the audience?
I'm sure you have that experience already. Yes.
I have a question, which is, I read yesterday that turmeric, I thought was very healthy, can be associated with liver problems. And can you talk a little bit about which supplements are good and which are not for the liver?
Well, to answer your first question, yes, there are reports both here and both in the United Kingdom about acute hepatitis caused by turmeric. But we're not talking about the plant itself. It is a capsule. And actually, when I look into it, Costco, in some commercial product, they add something else, which I don't know what it is, to enhance the turmeric concentrations and make the turmeric concentration to a point that can cause liver injury in some patients, because not everybody get it. We got, when I was still in the transplant program, we got referred to mother and daughter who were taking this capsule and getting into trouble. Luckily, they didn't get into trouble that need to be transplanted. So yes, it is true. But if you really want, the turmeric is antioxidants, and there's many different effects of that. So if you want to turmeric, grow them or buy the roots and then slice them into your food. And that, I think, have no issue. I always tell my patient, try not to use anything that is processed. Your food should be naturally produced, and you cook them yourself. So you know what's exactly inside that food that you eat. Yes.
I have another, they use black pepper with the turmeric to make it more effective. But I was also told by my doctors not to depend on Tylenol and Advil because of the effects on the kidney and on the liver. So long term, but I don't know, so how much to take and how long? I mean, years. Some people depend on those two for that. And the second question I have is there a simple blood test that you can take to discover if you have liver problems? Just like, you could take a test for kidney problems, a simple blood test.
Yes. To answer your second question first, yes, we do have blood tests that can detect inflammation of the liver. We call liver enzymes. And your doctor, I'm sure, every time you go for the routine checkup, I think that's part of the workup. If I'm not wrong, just like kidney part. We call it comprehensive metabolic panel, and that contains both informations. But it so happened that nature always play trick with us. So if the liver enzyme is normal, doesn't mean that's normal, number one, because everybody's normal range are different. Number two, the enzyme go up and down, sometimes high, sometimes low. So by the time you do the blood test, the one spot test, it could be normal, but you didn't know what's happening there. But the key thing that you should do is just be healthy with your liver. Then you really don't have to worry that much, okay? And to the first question you have is how much, Tylenol, yes. Yeah, right. Tylenol is more, if you have too much of Tylenol, it relates to the liver because liver processes the Tylenol. And they only have limited amount of enzyme to process the Tylenol into a very safe metabolite to be excreted. So if you overwhelm the system, the other way of disposing this Tylenol become toxic, and that can cause acute liver failures if you have too much of that. First of all, when somebody had pain, obviously this is pain, the first thing I ask people to do is use physical means instead of chemical means. So physical means makes a massage if you have headache, and there are agents that you can put. The one that I use on my kids and they love it is Tiger Balm. They have a capsaicin, which is what called substance P that come from chili pepper. They have anti-inflammatory effects. It works. So in my house, we have 3 or 4 of them lying around in different places. And when they go to college, one thing they ask for, besides chili from Zippy, is Tiger Balm. So the safe thing that we actually observe is if you take less than 2 grams of Tylenol a day, that's okay. If you're not drinking at the same time. And the ibuprofen is a drug that can cause gastric problems. And if you take too long of them, they can cause kidney problems. So those are the things that I would say if you need it, definitely use it short term and don't take it on a regular basis long term. I think that's the best practice.
I'd like to share something. I had been going to an oncologist, and he told me at one of my visits, you have fatty liver disease, because both of my readings were double normal. And I told him, I'm not having any symptoms, but it turned out, and it was the McDonald's mocha frappe. Okay. I had fallen in love with it. So I had it, maybe twice a week. I don't drink any alcohol, but I told him, let me try something. Don't go further with this liver disease, because I couldn't imagine. I stopped the mocha frappe, and my readings went right back down to normal. So I think, they always talk about alcohol with liver disease, but, there are other things, everybody, you go to Starbucks, mocha frappe, there are other things that are affecting the liver that are not alcohol. So I wanted to share, because my oncologist was shocked when it went down. He kind of chuckled that he'd never heard of mocha frappe, but I had kind of overdone it, like twice a week, I think is
Too much.
too often, but it was so good.
Well, thank you for bringing that up. Actually, fatty liver disease, we used to call it non-alcoholic hepatitis. Non-alcoholic. And the reason is in the 1980s, there was a very famous pathologist at Mayo Clinic, Dr. Ludwig's. He would read the biopsy when a doctor do a biopsy, and he would say, oh, this is alcoholic hepatitis, because based on the tissue, it looked like alcohol injury. But the doctors and the patient, I never drink. How can I get alcoholic hepatitis? I'm not a closet drinker. And he got enough complaint from his clinicians. He decided to look into it and find out that there are very similar pathology, but come from different reasons. And so the cause of the fatty liver disease is in the occasion we call mitochondria in the cell. Mitochondria is just like a powerhouse of our cells. And then if you have enough fat in there, either from alcohol, which is the disruptive metabolism, or because of your other metabolic problems, you're starting to damage the mitochondria. And that's where the picture under the microscope looks so much similar. So then he said, well, and then he published a paper. He said there is this condition that look like alcohol, but they are not alcohol. So we call non-alcoholic hepatitis. Now, over the last 5 years, my community say that is too stigmatization because you put fat, you put alcohol in there, like you just regular alcohol. We don't use that words anymore. We use metabolic dysfunction associated steatohepatitis, simply MASH. Okay, so we don't use NASH anymore. We use MASH now. But that is a very important thing that you brought up because there's a misconception there. And not all liver disease are from alcohol, okay? But alcohol liver disease are one that get people into big trouble. There was a question there. Yes.
If you no longer have a gallbladder, and it doesn't do much anyway if you have it, if you no longer have a gallbladder and you still have bad symptoms, what should you be eating and what should you be avoiding?
Well, like I say, the gallbladder is like a storage tank of the bile. And the bile is a very important component to help the fat to be absorbed. So obviously you want to eat food that is low in fat. Fried food and French fry probably is out the window. But our bile ducts can sometimes accommodate by getting bigger. You know, our body accommodate, if you don't have the gallbladder, the bile duct can get a little bit distended to serve as a storage. And therefore, people can have 6 months to a year later, they don't have problem anymore because that bile duct starting to take over the storage effects of the gallbladder. So try it. But, you know, in fact, we need fat. Fat is part of our, you know, nutrient. We just over-nutrient it. That's the problem that we have.
Thank you very much for your great discussion here. Quick question. Why do we have a left lobe and a right lobe in the liver?
Oh, Lord. I'm not a researcher on the tissue development. I really don't know. But someone up there knows that I cannot answer. I don't know. Just honest questions. I can go to the ChatGPT, see if they can give an answer. There's a 4.0 is free. Dr. Hinshaw. Oh, sorry.
So they recently came out with a product, topical Advil. Is there a difference between ingesting Advil or putting it on topically?
Which one? Oh, yes. Yeah, I think that's a good alternative. They work locally, basically, and sometimes some systemic, but mostly locally. And there's another agent called difronic, which is also coming into gel form that is also work on joint pains. Yeah, heat is the best. I find out, you know, the mild to moderate degrees of discomfort, heat plus Tigerbomb. Since it's a very, I'm not a commercial agent for Tigerbomb.
Do you know what percentage of people in Hawaii get the hepatitis vaccines?
Wow. For hepatitis, there were now the vaccines for hepatitis A and hepatitis B. And now hepatitis A is increasing every year because that's part of the pediatrics regimen for giving. Hepatitis B is pretty much universal now. So you have to look at the age group. in the United States, 1994, I believe, is the beginning of the universal vaccination for babies. So anybody who was born before that may not have hepatitis vaccines, unless they're in the medical field. So I cannot tell how much percentage, because the DOH have trouble tracking them, because we have a lot of immigrant that don't really, very difficult to assess if they got vaccinations. And many of them come from Southeast Asia. So to this day, I still see a lot of patients with hepatitis B, because there are people coming from area where they were endemic. And don't forget about South Pacific Islands. We have a lot of Chukis, Marshallese, that they have hepatitis B. That's a huge problem. We're trying very hard. We have hepatitis B in a group. We have people who speak their language. We asked them to produce, this is CDC was able to produce some in-language hepatitis B on site. So those are our efforts to try to see we can vaccinate the babies. But if they come here for having baby, they all get vaccinated for sure. So I cannot give you the actual number for that, but I think that we're starting to really improve because the vaccination program for babies are implemented in this country. Dr. Hinshaw is I would say, the initiator of this program, I was told. Thank you. This is wonderful.
I have a more generic question. I take 3 or 4 drugs, some blood thinners from my cardiologist, and I do it normally early in the morning with breakfast or just before breakfast. Would that punch of all of them at once cause problems versus spreading them out 1 pill per meal, say?
To answer your question, I think it all depends on if there are interactions. Now, if you're taking medicine that don't interact with each other, it's fine. But some drug A and drug B may be interacting with each other, either inhibiting their absorptions. And I think your doctor will be able to tell you which drug don't take it with another drug. Okay, but if they say it's the same, it's very compatible, then once a day is good. And which is good, because taking once a day pill is much better because they're more compliant. If you ask anybody, even doctors, to take medicine pills 3 times a day, don't even have 4 times, 3 times a day, they always forget. Okay. So we try to make things simple by making it just once a day. So every day in the morning you take it, or every night before you go to bed you take it. That kind of arrangement seems to really improve the compliance.
Thank you.
Yes. What about how would medical marijuana cream compare with Tiger Balm, as you suggested, with the, to avoid damage to the liver by taking too much Tylenol or other joint pain kinds of things?
Yeah, I think the question is about, her question is that in order to avoid taking too much Tylenol for pain or other drugs, can she use Pacalolo? Pacalolo could be classified in several different products. THC is one of them. CBT is another one. There's many chemicals in that whole category. And some of them were taken by smoke, some are taken by mouth, some of them were just, drops of a CBD. So I think it's all have its own different purpose. So I don't know if they have anti-inflammatory effects that's similar to Tylenol, or that they just numb your central nervous system so you don't feel it. Go ahead. Thank you. Cream. Yeah, thank you. I missed that first word, cream. Yeah, she means the topical use of the CBD. Yeah, I think that's perfectly okay. I just don't know, have there been studies to show that it does work? Okay. And you have to be careful about, it is not a regulated industries. So anybody will come out with something that may not have what they say inside there. So even though they were control of distribution, but they are not control in productions. And the production is a very important part of it because if you, for instance, if we take medication, the drug that approved by FDA, they have to show the FDA what they say, there's 10 milligram, there are 10 milligram in there. If they are deviated from that, they got shut off. It's very strict. Okay, and if there's any ingredient that is not supposed to be there, and they're found there, they also had to take another shot. So it's a very regulated, tightly, things for the prescribed medication. But this over-the-counter supplement thing is really not very regulated. I'm not saying that they are no good, but it just had to be careful about the source. But I think it might work. Yeah. No. Or I know the tiger balm that come from Singapore is the best. That's the original one. And I know that because if I put it in there, I can smell it and it burns. The burn part is the substance P, what we call, or capsaicins, which is the ingredient that come from chili pepper. So many people ask me, as a gastroenterologist, say, can I have chili pepper or spicy food without bothering my stomach? I say, in fact, the only thing bad about the chili pepper that we have here is their salt. So if you have a fresh chili pepper and cut it, and those are pretty good. Those are anti-inflammatories. That's why kimchi is pretty good for the digestive system, if you can take it.
Thank you so much.
Okay.
Oh, sorry. Thank you. Thank you very much. Do you have any guidelines for taking supplements? Because I take calcium and magnesium for osteoporosis. How do I judge what I should take or what I should not take? Thank you very much.
Thank you for your questions. That is a pretty tough question. As I mentioned, there is really no standards in that particular part of the management or treatment. So it all depends on where the source comes from and how reliable they are. But when you talk about calciums and those things, their dosage doesn't seem to be a very important factor in terms of toxicities. So you either take a little bit more in the ingredient, or you're not having enough, it's not going to affect you in general. So if you take it doesn't work, then that means there are not enough things in there. And I'm not just talking about calcium or any like glucosamines, all those things. But one principle that I found important is just to use known chemical means to improve what you want to do. In osteoporosis, there are medicine for that, specific medicine for that. And of course, you want to do calcium supplement if your calcium is not high enough. Too much of good thing is not necessarily good, okay? Too little of the good thing is not good, but too much of the good thing is not good because our body live in a very limited range. Your temperature should not be too high, temperature be too low, oxygen cannot be 100%, has to be right 21%. So go ahead. Well, the approval rules different between drugs and supplements, okay? The drug, you have to prove that is not harmful and it is effective. Those two things the FDA want them to prove. That's the approval of FDA for medicines. For food, you don't have to prove anything. Only when something happens. That's true because, and that rule is established by Congress in 1994 and never changed. We try to change that every year, the Congress, but there is this very powerful industry lobbyist that a lot of Congress persons just stonewall them. For instance, many years ago, there were this substance for energy. I don't want to mention that, but they caused suddenly a lot of people need transplant in our program. That's how we recognize something is wrong. Because in a week, we got 5 referrals for liver transplant. And Dr. Linda Wan and I just say, what's going on here? Is something happening here? So we start to look into it and find out the common source of these people taking it is a diet pills and energized pill. So we notified the DOH. DOH proactively look into it. We don't even have proof at that time. We just had the association, and I remember Sarah Park, she's the DOH. She immediately sent out his people to take that out of shelf. Okay. And we actually get a lot of complaint, and FDA don't even listen to it. We send our things to FDA, take them about a month to respond to us, because that is not part of their major jurisdiction for drug. They are food part. So that's kind of what we have to deal with. So what I can do is advise my patient to really use safety as a precaution first. Yeah.